Hello, my name is Sarah Nemick. If I had all of the healthcare in the world, I would make sure that I had the best doctors because I would be able to choose where I went. I'd have more options. I would get a wider range of care, like going to the eye doctor or having more mental health services. And I would be able to have medications and things that I needed for free. That would be the dream. I don't think that American healthcare is in a good place. I think it is difficult to access. I don't think that there is enough access for people. I think even if you have a good job where you should absolutely have healthcare or benefits along with that, you don't necessarily have that. And yeah, I think it's a major point of stress for a lot of people, and it shouldn't be so stressful and hard to have.
This is Matthew Bosque interviewing, being interviewed by Lilly Goines. I think it's trash, if I'm being honest. I think that it is far too prohibitively expensive to get good insurance. I don't know anyone who has great insurance, and insurance can oftentimes, for a lot of people, be the difference between life or death, between a comfortable, sustained life and a suffering life. And I don't think that as a country that has so many resources and so much, that anyone in the country should be suffering simply because they don't have the right job or have enough money like that, especially on a medical level. That's what I think. Honestly, increasingly no. I think that I'll do two answers. One will tie back to the healthcare, right? As a general person and citizen of the country, I think it would be naive for anyone to ever feel safe in America. America has way too much power. There's too much potential for violence from the state. I mean, like the police, the military, and stuff like that. And I think increasingly now we live in a time where just believing in certain things, believing in what I think are right ideas can get you harmed and can get you targeted and get you persecuted. And I think that's only going to increase moving forward. And that is a deep shame. And I am afraid and worried for the future of the country. On a healthcare level, no, I don't feel safe. I have personally experienced some health issues that have caused me to be in a huge amount of debt at different points in my life. I have personally have seen other people and have watched as people have suffered. You know, you can fall, slip on ice one day, and that is the rest of your life completely ruined because you can't afford the medical bills that the ambulance is going to cause you, and that is just not right. I think it's one of those things where in my own personal life, because I know that I don't have great insurance, I don't have great medical or dental insurance, I avoid going to the dentist, which puts me at risk for all types of diseases. I avoid going to the doctor, which I should because I have all these medical issues. I struggle to take care of myself because food is expensive and all these things are very expensive. I struggle to take care of my mental health because mental health services are so expensive. And I think that is all led to just an environment of anxiety around healthcare in America.
Hi, my name is Kevin Klein. If I had all the healthcare in the world, um, I'd feel great and I'd feel secure. I think I'll answer in two ways. One from myself, which is I've had a long stretches of my life without healthcare, and it's amazing how little you'll take care of yourself so you don't go into debt. Like, like maintenance stuff, like going to the doctor, like have an annual appointment. I went like 6 years without going to the doctor. I know, but it's just that's what happens because you can't afford it. You know what I mean? Because like the private insurance you can buy for yourself is so expensive that like you can just you have to eat and have rent or and you can survive. And that was luckily like in my my 20s, early 30s, you know what I mean? So I didn't have to worry about it too much. But the other part too is just like, like I'm lucky right now, and and this is crazy. Part of the reason why me and Katie don't get married is because if we do, they'll count both of our incomes, and then she won't be able to have Medicaid. That means Etta won't be able to have Medicaid, and Katie has asthma and depression and has a lot of meds, and she wouldn't be able to afford it without that, and Etta wouldn't be covered. And I remember my parents like debating whether to go to the hospital when I was sick and I was a kid or not, because like we were underinsured. And so like you would go like farther into a fever, farther into an infection, just to see if your body would kick it first before needing to go to the doctor. And like I would feel that way now about like Etta, and I hate that idea that like I would put her life in danger at all, or Katie's life would be in danger at all, just because the way our system is set up, that like we can't, if you can't be comfortable and have insurance, and you can't be, so you have to either be super poor and get insurance, or super rich and not have to worry about how much you pay for the good insurance. And it sucks. And on top of that, like mental health and the coverage for mental health is nothing. You know what I mean? I basically pay for the majority of my therapy and out of pocket. And like, it's like, that's the thing, like my mental health leads to all kinds of adverse behavior that affects my general health. And they don't connect them because they don't see mental health as a health thing that needs to be covered or tended to. So if I had all the healthcare in the world, I would just be happy. I would feel like, I don't even know what it would feel like. I'd feel like safe. You know what I mean? Like I worry about, even with insurance, you know what I mean? Like I worry about getting hurt or like something happening, because it only covers so much. It only covers so much before it even kicks in. So it's like a bad game. I'd feel great. I'd feel free. I'd feel safe. I'd probably take care of myself more. Our health insurance in this country has taught me how to ignore my health. Yeah, I remember one time I ended up with like double lung pneumonia and had to get hospitalized because we waited. I only could breathe out of 15% of my left lung.
Wow.
It was bad. But I mean, that's the thing, is like it's always going to be that way, and that's why it's really dangerous and inhuman and like really amoral not to have universal coverage so people can just take care of themselves. Especially since, like, let's just be honest, like there's people making tons of money off of really crappy food systems and food additives that cause like systemic issues, health issues, and all kinds of other things. And that the poorer you are, the more you consume those types of foods, and like, so it's just like a vicious cycle. And it's like just, again, the rich eating the poor, or even choosing to be vegan or something like that. Like you should be able to choose. And it's expensive. Like Katie just realized this morning that like vitamins she takes have gelatin in it, and she's like, and she looks up like ones that don't have gelatin in it, and they're like 70-80% more cost. But it's like art, having a sketchbook versus a notebook. One costs more just because of the idea. But that's a whole other thing. But but it should be like, like if you're a corporation, you should have to pay tons of taxes towards a healthcare system, because either you're degrading the environment, you're exploiting labor in people's bodies, or you're contributing to a food system that causes illness. And like you're responsible for like the healthcare needs. In short, healthcare should be universal, should be free.
Yeah.
Period. It's a human right.
Yeah.
To not be scared of walking out onto a street that the city doesn't take care of, or a sidewalk that a city won't tend to, and get hit by a car, and then your life is ruined. Yeah. Like that shouldn't be a part of it. All right, I'm stopping this because she doesn't want to edit this much. This is crazy.